Hi, I'm Antony, physiotherapist, nutritionist, and functional medicine practitioner. Welcome back to NxHLife, where chronic pain sufferers rise as pain warriors and learn to take back control. If you have had chronic lower back pain for months or years, if you've done physio, exercises, scans, injections, medication, psychology, and you're still stuck, this video is for you, because here's the uncomfortable truth. 2026 science is actually very clear about chronic low back pain. So the real question is, why are outcomes still so poor? This isn't about you failing treatments. It's about treatment failing to keep up with science. Let's unpack that today. The paradox of modern back pain care. We have more back pain research than ever, more clinical guidelines than ever, more scans, specialists, and interventions than ever. Yet, chronic low back pain remains one of the leading causes of disability worldwide. This paradox was clearly outlined in the landmark Lancet Low Back Pain series, led by Harvijan and colleagues. Their conclusion was blunt. Most chronic low back pain cannot be explained by a single structural cause. It's rarely just disc, a joint, or a muscle. Biological, psychological, and social mechanisms all interact together. And yet, most care is still delivered as if pain lives in one body part. That's the paradox. Science has moved forward. Practice largely hasn't. Let's talk about the first major failure point: atomistic thinking. This is when pain is broken down into isolated pieces. A disc bulge, degeneration, a weak core, stiff joint, nervous system, psychological or mental health. Each part is treated separate. But the series make it clear, non-specific lower back pain is rarely attributable to a single structure or single cause. Add to that the problem of imaging. Multiple systematic analyses show poor or inconsistent correlation between MRI findings and pain severity. People with significant pain often have normal scans, while people with major imaging findings can be pain-free. Yet, imaging is still overused, despite guidelines like choosing wisely, clearly advising against routine imaging and uncomplicated low back pain. This creates a dangerous loop. Scan findings drive fear, and fear drives protective behavior. Protective behavior drives deconditioning and pain persisting. The problem isn't that anatomy doesn't matter. It's that anatomy alone is rarely the answer in the misuse of psychosocial. Now, here's where things get more subtle and more damaging. Modern medicine often say, pain is biopsychosocial. That sounds progressive, isn't it? But in practice, something else happens. Psychosocial factors get treated atomically as well, just like biomechanics. Psychosocial becomes anxiety, thoughts, beliefs, catastrophizing, and the default response becomes CBT, reassurance, coping strategies. Let me be very clear. CBT can be incredibly helpful, and major Cochrane review shows psychological therapy improve coping and disability. But that same review also shows effects on pain intensity itself often modest. So when CBT is used as a universal solution, it becomes another one-size-fits-all protocol, just on the mind side instead of the body side. This is not what the biopsychosocial model originally meant. Getchell and colleagues were explicit. Psychosocial factors include biology, nervous system regulation, context, behavior, environment, and lived experience, not just mental health. Add to that trauma, chronic stress physiology, autonomic nervous system tone, lifestyle load, sleep disruption, identity and meaning, the person's pain story over time. As I often say, we didn't integrate psychosocial care. We just relocated the silo. This is where modern science has become much clearer. Stress is not just an emotion, it's a biological state as well. McEdwin's work on allostatic load shows that how chronic stress alters cortisol regulation, immune signaling, inflammatory pathways, pain sensitivity, trauma, including developmental and generational trauma, shapes how the nervous system detects threats. The autonomic nervous system, including vagal regulation, influence pain amplification, recovery capacity, tolerance to load. This doesn't mean pain is all in your head. It means pain is protective, shaped by the nervous system's interpretation on safety and threats. That's very different from blaming someone's mindset. Now, let's come back to movement, biomechanical methods, but not in isolation. Studies by Perez de la and Kirk show people with chronic low back pain often demonstrate altered movement patterns, but those patterns are variable, context-dependent, and influenced by pain history, fear, load exposure, conditioning, nervous system state. So again, the issue isn't that biomechanics are wrong, it's that prescribing the same exercise to every person is incomplete. Movement needs to be individualized, load-aware, confidence-building, integrated with biology and nervous system state. So what's 2026 science is actually moving forward? When you zoom out across the evidence, including the Lancet series led by Foster and colleagues, a pattern emerged. Modern chronic pain care is moving towards pattern-based, not protocol-based care. Multi-system, not siloed treatment. Context-aware, not diagnose-driven decision. Iterative, not linear recovery path. Person-specific, not condition-specific fix. Science isn't pointing to one new treatment, it's pointing to a better way of thinking. And what this meant for you. Here's the refrain most people miss. You don't need more random treatments, you need clarity. When you understand your pain map, your nervous system, biology, biomechanics, lifestyle, and pain story, something powerful happens. You can choose the right physio, know why psychology fits into your care, communicate clearly with the doctors, stop bouncing between providers, coordinate your care instead of reacting to it. As the shared decision-making literature shows, outcome improve when patients active partners, not passive recipients. A plan doesn't replace your care team. It allows you to use them properly. That's what real empowerment looks like. So, if this video helped you understand why things haven't worked yet, then the next step is not another isolated treatment. On January 17th, I'm running a free event called The Rise of Pain Warriors. We'll take this science and turn it into a clear, practical framework for chronic low back pain, so you can finally move from confusion to control. If you're ready to stop guessing and start understanding your pain properly, join us. And I'm Antony, and as always, let's turn pain into peace one step at a time. See you next time.